All right, good evening, everyone. Welcome to our Autism Acceptance webinar for tonight. My name is Latrice Rollins. I am an assistant professor at Morehouse School of Medicine in our Community Health and Preventive Medicine department, and I'm also honored to serve as the director of the National African American Child and Family Research Center. So I will share our disclaimer. Our center is 100% funded through a grant for the Administration for Children and Families, the Office of Planning, Research, and Evaluation. And so anything that is shared here is definitely the thoughts of those authors, of our presenters, and not the views or content of ACF, HHS, or the Office of Planning, Research, and Evaluation. I just want to give a little bit of background about the African American Child and Family Research Center through a video that was made just to give you some idea of the work that we do and our particular focus and research priorities.
The center is the first of its kind to focus exclusively on African American children and families. The majority of the research centered around African American families have been conducted using comparative research framework, where the behaviors, experiences, and outcomes of white families are viewed as the standard. This kind of framework ignores important historical and cultural contexts of African American life and inevitably places these families at a deficit in relation to white families. In addition, these studies have mostly been conducted by individuals outside of the African American community. The center seeks to change the cultural and institutional narratives about African American families by conducting research that takes into account our unique experiences and the social inequalities we face. The goals of the center are to advance a community-engaged and higher caliber research program focused on African American children and families, build research capacity and infrastructure to conduct research relevant to programs and policies under the administration of children and families, and effectively communicate research through a comprehensive dissemination strategy. Under goal number 1, the center will investigate the assets, needs, and experiences of African American families and children served by ACF programs. This includes temporary assistance for needy families, Head Start, and child care assistance programs.
Okay, I didn't want us to get too far down the line into that, but definitely just wanted to highlight a bit of what we do and who we are, definitely focusing on the programs of Head Start, Early Head Start, focusing on early childhood development, child care assistance, and our temporary assistance for needy families. So as you heard in our first goal, we're really focusing on ways that we can understand the needs and assets of African American children and families. And so that is why we're having this awesome webinar series focusing on autism this evening, particularly autism in Black families. And so I am going to pass it to Dr. Adeola just to make sure, because it looks like my computer is doing something weird. So
good evening. I hope that everyone can hear me right now. I'm going to go ahead and share my screen. Wonderful. So thank you, Latrice, for inviting us all to join you today in this important discussion about autism in Black families. My name is Dr. Adeola Sonaike, and I am the Chief Operating Officer at Baker Street Health. And before I get into our discussion this evening, I just want to take a moment to share a little bit about Baker Street Behavioral Health and Core Behavioral Group. We are what I like to call a unique center that is based in Northern New Jersey. We have 2 locations that provide a mix of mental health services and behavioral health services for pediatric aged individuals, in addition to an array of offices and locations throughout New Jersey and telehealth services in 36 states. And I love to talk about our 2 centers in New Jersey because they really are unique in the fact that we support not just the needs of individuals with autism, but the families, the siblings, the parents, the caregivers through our behavioral health services. And that's a little bit of what I'm going to talk to everyone about today as we think about intersectionality in neurodiversity, and we think about how we appear in healthcare systems, in social services systems, how individuals of minority descent access services. And that really starts with defining the condition that an individual has and understanding the diagnostic process to then access those services. So that's really a bit of what I'm going to talk about today. And throughout this talk, I'll bring in some best practices that we have been able to implement at our Pediatric Developmental Center, specifically in North Jersey, which is, as I mentioned, is a combination of mental health services and autism behavioral services. And so just to start us off, I'd like to really address what does autism mean to different communities, and how does it show up in different communities. This is Autism Acceptance Month and Autism Awareness Month. We're seeing a transition in the definition or the defining terms to determine if someone has autism, whereas, you know, we've gone from the space where people would talk about things like Asperger's to autism spectrum disorders, and now we're starting to hear the terminology neurodivergent and neurodiversity. And one of the things that I think it's really important is that irrespective of the language that we're using to define and discuss autism spectrum disorders, that we recognize that it is very prevalent in our country and in our communities. And so currently about 1 in 44 children in the United States are diagnosed with an autism spectrum disorder. And this can involve individuals who just have ASD or individuals who have ADHD as well. There are different places where an individual can fall on the spectrum. And there are different behaviors that are associated with where they fall on the spectrum. And these are things that we as healthcare professionals like to monitor and be aware of. Despite this, we still do find that the majority of healthcare professionals are not feeling comfortable or adequately prepared to provide supports and services to children with autism spectrum disorders, or even to support their families. And that's part of why we're doing what we're doing today, which is really increasing the education that's out there that talks about treating, supporting, and diagnosing children with autism, but also being able to recognize that autism is just one component of this individual's life. There are so many other facets to their identity that impact the way in which they show up in the healthcare system. And it's important that we're aware of that and that we're discussing that. One of the things that we have also heard from families is that, you know, when they are accessing the healthcare system, they have had many negative experiences, and that changes the way in which they show up when they are in front of one of my providers at Baker Street or CORE. Their adverse experiences with other providers, the judgment that they sometimes faced, or being told that, I'm sorry, we can't help you. It often leaves families in a place of despair, confusion, increased stress, and really a lack of trust within the healthcare system. And so we do spend a significant amount of time really trying to heal that disconnect and really trying to make sure that we're building a rapport with the family. And we do this by meeting that child and that family where they are, acknowledging, respecting, and appreciating all of their intersectionalities, even if we don't look the same or have the same background. Being able to create a space where we're listening carefully to their feedback, creating a space where they feel safe. Over a decade ago, when I first started working with the autism population, I was in a community-based program hosting play therapy type programs for children with autism. And I will never forget a young lady, she was probably around 7, and we were doing different activities at this developmental center, and she was really nervous to be there. It was her first time really participating in a social skills group. And I remember just at one point looking at her and sitting down with her and saying, you are safe here, you are safe with me. We're going to make sure this is a safe space for you. And just her hearing me say the word safe and actually meaning it changed everything for her that day. She was able to participate. She felt comfortable with me. She felt comfortable participating in the activities that we had planned for her that day. And that goes for all of us, irrespective of our age or our background. When we're talking about our healthcare, when we're talking about our development, when we're talking about our children, we want to make sure that we are feeling like we're in an environment that is safe. And so as providers, we want to make sure that we're being respectful and creating that safe environment, and also recognizing that the identity varies from family to family. And so the experience is going to vary from family to family. One thing that you'll hear me saying a lot today is that when you've met one person with autism, you've met one person with autism. And so just because you've met one Black child that has autism does not mean that their experience or the way they present is going to be the same as another Black child who has autism. And once again, we want to avoid making assumptions and really taking that time to build that rapport, to understanding the family's needs, to understanding their experience, so we can be a part of this journey in collaboration with them. As I mentioned, a lot of healthcare professionals do acknowledge that they do not feel adequately prepared or trained to provide appropriate care for children with autism. Furthermore, a lot of healthcare providers express that they do not feel that they have the cultural competency to serve minority families. But we are seeing some improvement. When I first started working in the autism space, the population that we were serving was predominantly white, and there were lots of conversations about this is a condition that is popular and prevalent in white communities. And that is not true. What we've seen is it's due to a lack of access to an appropriate diagnosis that we were not tracking or capturing the number of Black children and other minority children who also had autism. And over the years, we're starting to see that gap shrink. It's not as wide of a gap as it used to be. We're seeing improvements in the diagnostic process and access to diagnosis for Black children, but we're not there yet. We still have a long way to go, and conversations like this are going to help push the needle in the direction where we can be more equitable in the provision of diagnostic supports. So why am I talking about the diagnosis so much? When we look at the autism population, it all really starts with when, where, and how that child is diagnosed. And it's important because in the autism space, the sooner a child can attain their appropriate diagnosis, the sooner we can get them into appropriate care, interventions, and supports so that they can live their best lives, so that they can thrive and achieve their maximum capacity of what they are capable of achieving. And it's our goal as providers to create a space and create communities and infrastructures that allow that child to thrive. As I mentioned, historically, Black and minority children, specifically Black and Hispanic children, were less likely to be diagnosed with autism spectrum disorder. We are closing the gap, but we're not there yet. There are still significant delays that Black families are experiencing when trying to access their autism diagnosis or any services related to the needs of their child. They report seeing multiple specialists before they receive an accurate diagnosis. And this really connects back to the socioeconomic status and many of the issues that we have with the infrastructure of the healthcare system in the United States. We find that there are many situations where Black families are telling us that nobody is believing them, nobody is understanding what they're expressing when they're saying that they're seeing new or different behaviors in their child or their young adult. They often are saying that they are receiving judgment if their child is not meeting specific developmental milestones, and they don't always know which specialist they should go to next. Let's see. Just want to make sure everyone can still see me.
Yes, we still see you, but you just have to reshare your screen. Sorry about that.
Okay. No, it looks like I'm unable to share my screen. It's been disabled. Okay, there we go. Thank you. All right. And so it's really important that we are making sure that we're spending time on identifying and understanding why Black families are unable to receive an accurate diagnosis as soon or as early in the child's life trajectory as white children. And this really connects to many of the socioeconomic gaps that we see in the healthcare system and the lack of equity in the healthcare system in general. Oftentimes, if a family is seeing multiple providers, they are then being asked to repeat at every appointment what they're noticing in their child, what is different about their child's development in comparison to the developmental milestones that have been outlined to them, who they've already called, what challenges they've already encountered with identifying another specialist, the wait times to see a specialist. All of these different factors contribute to the barriers that families are experiencing, which leads to burnout, frustration, lack of understanding from the part of the providers who don't understand why a family is upset at their first appointment, not knowing the history of what that family has been through or how many times they've had to explain the exact same situation without getting any answers. All in all, the diagnostic process and what we like to call the diagnostic odyssey, because it really is a journey that has many ups and downs and twists and turns, has a significant mental health impact on the entire family. And when we talk about the diagnostic odyssey, we look at it in three different phases when we're looking at autism. The first phase is pre-diagnosis, the second phase is during the actual diagnosis process, and the third phase is post-diagnosis. And each of these different phases has a significant mental health toll on the family, which is part of why we have combined our services at Core Behavioral Group and Baker Street Behavioral Health to be able to meet families at each step along the way, irrespective of who they are getting their diagnosis through or which providers they are working with. We are that supplemental provider that is able to support the entire family unit. And so in the pre-diagnosis phase, we're seeing that families are experiencing delayed access to even getting the conversation started about their child needing to be evaluated. During the actual diagnostic phase, they are then experiencing delayed access to diagnoses. That means delayed access to a provider who can provide them with that accurate diagnosis. And then once they do get that diagnosis, we are seeing that they are finding delayed access to any form of developmental therapy or early intervention that can connect their child to the needed services and supports. So focusing first on pre-diagnosis. This is the whole idea of making sense of your child's differences and feeling comfortable and safe with having that conversation with your provider about your child's developmental milestones, feeling that you're not being judged if your child is not meeting certain developmental milestones, recognizing that there are systems there to support you and not to judge you. Families are facing wait lists to see a developmental pediatrician. And this is also connected to the fact that many families are having to see multiple specialists before they can receive an accurate diagnosis. Ways in which we can acknowledge the mental health toll and really support families during this process is training and advocacy. For me, is number one. Training families to be proactive in the diagnostic process by asking the right questions, teaching families about what are the developmental milestones, what are some things that you should be looking out for if you have any concerns, how you should feel safe with sharing that information with your nurse, your provider, your social worker, just having a space where you feel comfortable. And it's our responsibility as providers to create those spaces. It is our responsibility as providers to educate, train, and prepare families to be able to advocate for their child. I always say that the best medicine for a child is a parent who is a great and strong advocate. But it takes time for us to get there with families. We have to build that rapport once again. We have to create that space where there can be trust and understanding. We have to make sure that they feel safe with sharing their family concerns, because culturally, there may be certain things that you're not supposed to talk to strangers about or healthcare providers about. You know, there's that whole saying of what happens in the household should stay in the household, or that's family business. We don't talk about that. And so really having that conversation with families and saying, that's family business, and I'm not a part of your family, but I'm here to help. I'm here to support. I want to create a space where you feel comfortable so we can work together to help your child, to get to a space where your child has access to the services and supports. So let's walk this journey together. I will be with you every step of the way, asking the questions for you, making the phone calls for you when you can't make them, and also connecting you to the services and asking the caregiver, this is a challenging process. Are you okay? Do you want to talk to someone? And having those resources available of culturally competent providers who they can talk to. And then we have the neuropsychological evaluation. So this is the during the diagnosis phase, where families are starting to speak to the specialist. They're starting to ask questions about the child's behaviors. They're starting to ask questions about how they solve problems, how they process information, how they store information, how they regulate their emotions, and how they behave. And when we think about behaviors and the regulation of emotions, a lot of mixed feelings can come up, and we as providers need to be aware of the environment that we're in and the conversations that are being had when it comes to the behaviors and the emotional regulation of children of certain backgrounds. And so making sure that we're creating that, once again, safe space where there's no blaming, there's no judgment, and recognizing that we need you to be honest and open about sharing information that you otherwise may not feel comfortable sharing, so that we can get to the right diagnosis, so that we can support this process and then connect you to services and supports that can help transform those behaviors, that can help improve the life trajectory of your child. This, once again, can be a very tedious process for families. Once they're sitting in front of a developmental pediatrician or a neuropsychologist receiving this evaluation, there are questions that will be asked that will feel uncomfortable for them. And so letting them know that this is what it takes, these are the questions that may be asked. One of the things that we do is we educate the front desk staff and the nurses and the doctors at different practices so that they know what our evaluation process looks like, so that when they're referring families to us, the families are prepared. And we do prepare the families as well, but we like the families to know or have an idea of what they're getting themselves into before they call us, so that they're not surprised or concerned or feeling that we are being too intrusive with the questions that are being asked during the neuropsychological evaluation. And one thing I do want to add about this is oftentimes families will be told that, you know, to get that accurate diagnosis, you need to see a developmental pediatrician, which is true. However, there are very few developmental pediatricians right now in the United States that have any openings. Waitlists can be for up to 1 year. And in the autism space, the sooner you get the diagnosis, the better for the child. And so there are other providers that you can see to get to that accurate diagnosis, one of which being a neuropsychologist. And a neuropsychologist can actually spend a significant amount of time observing and talking to the child and to the family, whether it's the parents, the caregivers, the siblings, to really get a sense of how the child operates, how they process things, so that we can arrive at an accurate diagnosis. And the diagnosis that is provided by the neuropsychologist, who is a trained, certified healthcare professional, is acceptable by insurance companies, by school districts, by state providers, to say that, yes, this is the diagnosis of this individual, and yes, they are eligible for these services, or they are eligible for this medication, or they're eligible for this type of therapy. And so I just want to put that nugget out there, because it is something that a lot of people are not too aware of. And when they hear that there's a 1 year waiting list to see a developmental pediatrician, they often feel like they've hit a dead end, and they are frustrated with that. And so the other thing about this process is recognizing that whatever the outcome of the neuropsychological evaluation is, it can have a mental health toll on the family. And so identifying available mental health professionals who, whether it's in-person sessions or telehealth sessions, who can meet with the family and discuss what this life transition is going to do to the household, how it's going to change the household, how it's going to transform the way that everyday life looks, and really helping them to navigate that and process that. And then we have early intervention. And this is what it's all about, right? Getting to that diagnosis as soon as possible so that we can have an early intervention that can allow for a better outcome and a better quality of life for our children. And early intervention includes an array of different supports and programs, whether it's speech therapy, occupational therapy, ABA therapy. The ultimate goal is to connect the child and the family to the services and supports that they need so that they can thrive. And so as providers, we want to be aware of what these different supports and services are that are available to the children in our community. We want to be mindful that it's not always easy to access some of these services and that they're going to be navigating a very complex system of care. And so even having a basic understanding of how that works in your community or in your state is very important. You know, knowing, is it the school district that pays for the services? Is it the health insurance company that pays for the services? What information do I need to have on file in order to access these services? Do I need a case manager or do I need a social worker? What age do they age out of certain services and how do I prepare for that? And so really being able to have a basic level of understanding of how things work in your state so that when the child and their family are saying to you, okay, we've been given this diagnosis, now what do we do? That you're able to at least continue to be a part of that process for them, recognizing that this post-diagnosis phase is still a part of that diagnostic odyssey. And when you're in this phase with the family, it's really important that we think about what I say is nothing about me without me. And that is really making sure that the child and the family are at the center of the care that is being provided and determined for that child, that we are providing, you know, child and family-centered clear care that has clear roles for every member of the team. And as you're adding other members to the team, other providers to the team, that everyone is communicating with and about that family, with and about the child, so that they can be a part of their process to access care, supports, and treatments. And this is really important when we have children who have other conditions that they're also being diagnosed with, whether it's a mental health condition and an autism spectrum disorder, or a learning disability and an autism spectrum disorder. We want to make sure that all of our specialists are talking to each other, but are also connecting their services and supports to the actual needs of the child and making sure that they're building a program and a system that's really going to work for this child, irrespective of their background, their socioeconomic status, that it's really built to fit that child. And so just to provide a quick review of some key things that we want to keep in mind when we're talking about providing equitable and appropriate care for Black children with autism. We want to overall create a culture of health for all people, creating a space where inclusion and equity is at the center, where it is prioritized, where we are addressing and understanding the community that we're serving, understanding what their needs are, understanding what supports are available in the community, which of those supports are safe spaces, which of those supports have providers who are culturally competent. We want to remember that backgrounds, abilities, and experiences are different from family to family, from child to child. As I mentioned, when you've met one person with autism, you've met one person with autism. When you've supported one Black child with autism, you've supported one Black child with autism. And things do not connect and carry over from child to child, from family to family, because everyone has their own unique experiences. And so you want to make sure that you're openly discussing those with the child and their family, that they feel safe to talk about their experiences with you, that you're learning from that, and not learning because, you know, this is your opportunity to increase your cultural competency, but learning and listening so that you can make sure that you are connecting them to services and supports that will work for them. And overall, you want to make sure you're maintaining a general respectful environment, and that includes developing a worldview that does acknowledge and respect intersectionalities, because what makes us different is also what makes us beautiful, and it's also what helps us create a space and communities and infrastructures and programs that are truly accessible for all of us. And that's it for me so far.
Awesome. Thank you so much, Dr. Sonaike. And I just want to also mention that Dr. Sonaike is also a technical work group member of our National African American Child and Family Research Center. We certainly value the expertise that she brings, particularly in this space around children with any type of special needs, and also the equity lens that I learned about since we are both Robert Wood Johnson Foundation Cultural Health leaders. I got to learn more about her work and definitely wanted her to share her expertise with you all. So thank you so much. And again, if you all have questions, please put them in the Q&A at the bottom of your screens. We will definitely answer any questions that we can, live in the box, or if there are questions that you need further explanation, we'll do that at the very end. Thank you, Dr.
Thank you.
So now we are going to go to our next presenter. And that is Ms. Danyale Sturdivant. Danyale is a Russell Sage College and Columbia University graduate with a master's degree in advanced clinical social work. Yay, social work. She also holds a certification as a dual diagnosis specialist through the National Association for the Dually Diagnosed. She is also has worked in the mental health field for over 20 years in various settings in the public and private sectors. Ms. Sturdivant's area of expertise is on BIPOC families of children with autism spectrum disorder and intellectual developmental disabilities. She founded Living Autism Out Loud, LLC, to reduce and eventually eliminate barriers that BIPOC families of children with autism spectrum disorder and intellectual developmental disabilities experience when accessing services for their children. So we are going to hear from Ms. Sturdivant. I will advance slides for you.
Good afternoon, everybody, and thank you so much for having me. I'm going to talk about navigating the challenges of parenting a Black now adolescent with autism. And I started out a little bit unconventional for me. I want to start out telling you all what I've learned. Next slide. So this is what I've learned. There are several things that I'm learning on my journey through autism with my son, Joshua, as my tour guide. I've learned that it's difficult for some people to see him as he gets older. I've learned that the world is less forgiving for his missteps in social situations. I've learned that things that were once considered cute are no longer. I've learned that parenting a Black male on the autism spectrum is an ever-evolving journey. I've learned that my advocacy and support can never waver and can be the difference between life and death. Next slide. So what are some of the challenges and barriers to services? So some of the challenges of navigating services for my son and our family have been things as small as microaggression in some instances, implicit bias, racism, and a lack of information and access to resources. So let me give you an example of a microaggression. My son was in the 5th grade and I received a call from his teacher saying that he had committed a microaggression. And I was very curious about that because I can't even get him to clean his room. So I'm like, I don't know what he could have possibly done. And I think Dr. Sonaike said it best when she talked about being culturally competent and understanding families of children with autism and what children with autism look like and how they present. So when I called his teacher, she said, well, Ms. Sturdivant, he took a pencil from another student. And she considered that a microaggression. And one of the things I want us to think about is I want us to think about the terms that we're using when we are describing Black children in particular with developmental disabilities and or autism. I'm not sure how that was perceived as a microaggression. I have my guesses, but it's one of the things that we have to think about. What are our thoughts when we're thinking about children that are a little bit taller, a little bit older, a little bit bigger, that have these same disabilities? How are we labeling them and what are we talking about? The implicit biases, the same thing. Racism, the same thing. These are things that happen on a daily basis. And for the parents out there with children that are in my child's age bracket, one of the most difficult things I think for us is trying to explain to our children why someone may treat them a certain way or why someone may act a certain way toward them. And that's been a forever challenge because my child just sees people. and other people see Black and they see male and they see, they might know that he has autism. And so they see these things and they have these preconceived notions about who they think he is. And so some of the barriers are really just talking to people about my son and explaining to them that no, he's not who you think he is. This is actually who he is. And as Dr. Sonaike said earlier, every time I have to go to a different person and tell my story, it re-traumatizes me, and it probably does something to him because we're bringing up the same trauma over and over. And as a Black mother, I can tell you that I don't often get a chance to speak about my mental health, as Dr. Sonaike talked about. And I don't often get a chance to speak about the trauma of having a child, with a disability, because that's kind of not expected of us. We're kind of expected to roll up our sleeves and get moving and kind of do what needs to be done. And so I can also speak about just the way that my son was diagnosed. Fortunately, he was diagnosed at the age of 2 after having a developmental disability. So he was diagnosed at the age of 2. So I was able to get early intervention in all of those services. But I wonder about the people who are not able to do that, the people that look like me, that don't have access to those same resources that I had access to. It's just, I know that there is some research out there that supports medical professionals saying to African-American mothers, oh, you need to wait, just wait it out. I know you're noticing these things, but wait and we'll see. And then for the other side, I've talked to hundreds of parents of color with children with autism. And sometimes I hear things like, well, his brother didn't talk until he was 4, or, his uncle was that way. And so they feel like they normalize the behavior. And I get that, and I understand why. So they normalize that behavior when we really should be asking questions and really trying to get these medical professionals to talk more with us about, what's going on with our children. Next slide. Okay, so there have been some challenges of discussing autism with my family and friends. And so in addition to what Dr. Sonaike talked about with discussing the diagnosis with professionals and talking to professionals about, what we're seeing and what's different, there's also a challenge in discussing, in some families, mine in particular, there was a challenge in explaining that my son has autism. And I have to parent this way, and I can't use the methods of parenting that were used on me because he's a different child. And, it's a tough conversation to have, but I think when we're working with parents and when we're talking with parents, we have to give them a different toolbox to use because they're discussing different information. So they're just not talking about a kid who maybe is just misbehaving because he's just misbehaving or age appropriately oppositional. We're talking about a child that actually has a disability and where some of those behaviors cannot really be helped. So what I shared with my family and friends about my son's diagnosis was that he has autism, and I didn't get too technical. I explained to them a little bit about what autism was, but I felt like it was important for them to hear the term so that I could kind of slow walk them through the process, because this autism thing is a journey. So it's not a one-stop shop. It is an absolute journey. So, I did give them information about it, and it wasn't easy. I had family members who didn't believe me. I had family members who were upset. And I will share this for those of you who have children that are newly diagnosed or you're working with families. One of the things that I didn't do, and I have learned to do, especially listening to the previous presenter talk about mental health, is I learned to realize that my mother was probably the most upset of all. And one of the things I didn't realize is that she was grieving, just like I was. And so let's give our families time to kind of go through that grief process. So if they're not responding to you right away, or they're not calling you, give them time so that they can process and understand what's really happening. Next slide. And to that same vein, there have been some challenges for advocating for my son in the educational system, as the presenter before me spoke about. In some systems, the educational system in particular, because my son has autism, he has ADHD, and he has anxiety, somehow the autism part, even though that seems to be a big part of how he responds in the world, somehow that part was getting pushed to the side. And his behaviors that were related to his autism and ADHD were becoming the big deal. And so the behaviors that he had, related to those diagnoses became paramount, and the fact that this kid actually has autism and is actually on the spectrum became smaller and smaller. And so I decided that I would start educating my son's school system on what autism looks like for him, how his autism shows up, and then how all three of those diagnoses work together for him. And we were able to be successful, and come up with a plan, but it was a conscious effort, because a lot of times children of color are often pushed into the behavioral group where they just have these behavioral problems and they need all this intervention. But when you have a child with autism, it's very important that you also let them know that that's a part of the equation too, and that cannot be ignored, nor can it be negated. Next slide. So why do I introduce my child to law enforcement and EMS? One of the things that you all know, I'm sure, is that African Americans, males, children too, there's a high instance of incidents with law enforcement. So what I wanted to do is I wanted the local law enforcement here in my community to know who my son is, so that in the event that I have to make a call because of whatever, a behavior or whatever, I want them to come and I want them to be able to intervene in a way that does not cause harm to my son and does not cause harm to me. So by talking to local law enforcement and explaining to them who my son is, what his autism is, what could possibly happen. For me, I think it just kind of gives me a little bit more peace than if I'm calling, out of the blue and I'm saying, I have a situation, I need you to respond. This is debatable. I mean, not everybody does this, but for me, it was the only way that I could really find comfort. And I feel like this way, I'm keeping my son safe because I'm humanizing him and I'm introducing him to people so that they can see who he actually is. Maybe not who he is when he's having a meltdown, but who he is prior to that. And so that's why I do it. But again, people have decided or thought about different ways to do that. And some people say, well, you're making him a target, for law enforcement. And I'm really just trying to do the opposite. And it's a personal choice, but that's, what I chose to do. Next slide. So what can professionals do to reduce barriers? And the previous presenter talked a lot about this. Practice cultural humility and responsiveness. Understand, ask questions, allow parents to be the experts on their children. If you don't know, ask questions. Do not assume that you have all the answers. I've been a social worker for a long time, and I was trained back in the day where, we would just kind of tell parents what to do. And if they didn't do it, we would say they were non-compliant. And what I've learned is it's more important, and the work can be done if we strive for a partnership with parents using a team approach. And so the parents are a part of the team. And so they get to give you information. And yes, you may know medically, and yes, may know mental health, but the part that the parents can give you is definitely a piece of that puzzle. And so if you can get that whole puzzle together, I think it actually informs treatment, and it makes things easier for the family. It's easier for you because you're actually getting the information that you need. Just understand that sometimes we as parents don't know the right technical terms to use. So if you can talk to us in layman's terms, that would be helpful. If you could understand our lack of responsiveness or a lack of communication with you sometimes it's a lot to process. And in my case, I had my mother, my father, my sisters, I had all these people to explain to. So it wasn't always feasible for me to get back to somebody, within a week or something. So there's a lot of different variations that happen for us as parents of children, with autism and or intellectual developmental disabilities. Next slide. So what can parents do to take care of themselves? Now, this is what I didn't do, because for me, I got the diagnosis and I took off running like a rocket, and I just kind of ran myself out until I had to stop. But remember to reach out and seek help from friends and family. Build a support system. And I want you to know that sometimes it won't be your favorite friend or a family member, or it won't be that favorite auntie or the person that you thought, would be there for you, ride or die. Sometimes it's not that person. Sometimes it's someone who has lived experience that helps. And what I really want all the parents to know is it's a marathon and it's not a sprint. And once you are able to take a deep breath and kind of be in the moment and be in the space, and understand that there's a lot more to it, and there's a lot going. So, I mean, you can sprint if you want to, but there's going to be a lot. So pace yourself and understand that you do need a break, and it's okay to say, I need a break. It's okay to call on other people. Those are things that you're going to have to get comfortable with, as a parent. And these are things that I had to learn, unfortunately, the hard way, but it definitely helps. Next slide. I'm sorry, next one. And I really have to say this. I want to give a special thanks to my wonderful son, Joshua, for giving me the courage to share my most important lessons. You all, if it wasn't for his, even in his silent way, his support and his, just giving me the strength to do this, because as the presenter before me shared, it's an emotional toll. It's a mental health toll. It's a thing. So I want to thank him for that, and Dr. Rollins and Morehouse School of Medicine for allowing me to have this opportunity. And thank you to the other presenters for your validation. And that's it for me for now. Thank you all so much.
Thank you so much, Ms. Sturdivant, future Dr. Sturdivant. We thank you for sharing your lessons learned, as well as some tips for parents that are in the same situation as you, as well as tips for professionals as well. So thank you so much for sharing with us. And now we're going to go to our next presenter. Our next presenter is Ms. Kelley Hollie. She has earned her undergraduate degree in social work with a concentration in physical and mental health from Baylor University. She also has a master's in social work and is completing specialization and completed specialization in international social work and global women's health issues. As a part of her program, she has 18 plus years of social work experience in child protection, clinical practice, international adoption, foster care, nonprofit management, and teaching in higher education. She currently resides in Phoenix, Arizona, where she is a part-time therapist in private practice. She teaches also social work classes at Arizona State University and functions as a research assistant in the biomedical department focused on autism. She serves as the chair of the Committee for Education and Training for the Black Female Fatherhood Scholars Network. And she also leads a racial reconciliation small group through Be the Bridge to Racial Unity. And she recently published an article focused on autism in Black families. Kelley will begin her PhD in social work at Arizona State University in the fall of 2023. And she is the proud mother of 2 young children with special needs. So please let us give her the floor and our attention.
Thank you so much. Thank you. Thank you. I'm trying to share or turn my video on, but it's not letting me, Dr. Rollins.
Okay, I'll get you in a moment.
Here we go. Dun, 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 dun. Here we go. Yay.
There she is.
So I just want to say thank you so much for the opportunity. I'm really excited, a little bit nervous, but mostly excited to be doing this presentation and to be connecting with such amazing other presenters who share my interests and my passion for autism. So we wrote, I assisted and co-wrote an article with all of the names that are listed on this first slide. And we looked at exploring coping in parents of Black autistic children. So this is just the summary presentation of what our paper discussed, and hopefully it will be helpful and illuminating to you. Next slide, please. So just an overview for autism spectrum disorder. I'm sure that we're all aware of this information. 1 in 54 children are affected in the United States, according to the CDC. When compared to white children, Black children are often diagnosed later or misdiagnosed with ASD. Disparities exist between Black and white children's age at first developmental evaluation, and then co-occurring intellectual disability diagnoses are often attributed to access to quality healthcare and perceptions of autism symptoms by the families and providers. Past experiences of unequal treatment in healthcare contributed to families' resistance to receiving autism services. So what does that tell us? Trauma begets trauma. And when you've been traumatized by the system, it makes it really difficult to trust the services that are being provided to you. Next slide, please. So a little bit of research background for you for our study. Clinical bias is attributed to disparities in autism diagnoses across different racial groups. Aggregate of these proposed factors increase delays in proper diagnoses and underdiagnoses for Black children. Research indicates that Black parents of autistic children were more likely to report their physicians did not spend enough time with them as compared to white parents of autistic children. And I am the proud mom of 2 littles, and they both have autism, and I can testify to that reality that oftentimes we did not get a lot of time with the prescribing doctor in order for them to do a thorough assessment and determine what the situation was. Research also suggests that Black parents report various experiences of discrimination while seeking and accessing services for their children. And that can come in many forms, whether it's the assumption that a Black mother is a single parent and that the Black father is not involved with the child or not engaged in medical services, all the way to blatant and outright experiences of discrimination and prejudice in the assessment process or in the delivery of services. And I hear a theme being echoed from the other presenters, just that there seems to be a withholding of information, and that seems to be attributed oftentimes by participants in research to their racial and cultural backgrounds. Next slide, please. Diagnosis and treatment processes are often longer and more burdensome for Black families, and that creates more stress for the caregivers, and it increases the gaps in accessing quality healthcare for autistic children. Parents of children with autism report higher stress levels than parents of children with other developmental disabilities, including Down syndrome. I know that there's a study that just came out at the University of Wisconsin that likens the stress, the stress load that autistic parents experience, parents of autistic children experience, is similar to that of combat veterans coming back from Iraq and Afghanistan. Caregivers report clinically significant ranges of parental stress, with stress focused on ensuring their child's safety and emotional well-being, right? So we're out there in these streets trying to ensure that our kids are safe and that their emotional well-being is being protected. Families of color additionally experience structural racism and discrimination, and that's built in and baked into the systems that they are interacting with. So really, really challenging stuff. Next slide, please. So coping strategies. We know that Black families are underrepresented in research. Specifically, few studies center the lived experiences of Black families raising autistic children, and there's gaps in understanding how Black parents of autistic children cope with stressors, or the context that coping even occurs in within Black families. I would also offer to you all that there's a lack of research surrounding how Black fathers in particular are impacted by a diagnosis of autism and how that in turn shapes their fathering practices. Future research should examine the influence of cultural values, systems of oppression, and support networks on coping strategies among parents of autistic children. Next slide, please. So our paper was rooted in the Black family stress and coping model. We wanted to consider cultural and contextual factors that influence how stress and coping occurs in Black families. That was really important to us. We based our paper on the ABC-X model, and we explored pathways that facilitate adaptive and maladaptive coping in Black families. We chose this approach because it incorporates cultural strength-based coping constructs as key protective factors that mitigate the impact of stressors, including optimism, kinship support, because we're all about the collective, church involvement and spirituality. We cannot underestimate that, and collective socialization. Next slide, please. So the aims of this paper was to provide insight into the coping strategies of Black families, to explore how parents cope with daily stressors, and understand the role that culture plays in the use and effectiveness of coping strategies to improve systems of care. Next slide. In our study, we had 22 participants in this study that were Black and primary caregivers to an autistic child under the age of 18. All the participants were female, so a limitation of our study was that it lacked diversity in the types of primary caregivers and in gender. So dads were not included in this study, and we weren't looking at grandparents or aunties or other caretakers. Participants were between the ages of 27 and 61 with an average age of 40. Half of the sample was college educated, and the children ranged in age from 3 to 17, with 10 being the average, and the majority of the children being assessed were male, 88%. Next slide, please. So we did a mixed method study looking at, we gave families a questionnaire to complete called Ways of Coping questionnaire that measured cognitive and behavioral strategies used during stressful situations. And we also conducted semi-structured interviews where participants were asked about strategies they utilized to reduce stress and burden, asked about the impact of race on their and their child experiences. And I just want to say that this concept of reducing burden, there's so much about, you know, the trope that's commonly associated with Black women is the strong Black woman who has like really broad shoulders and she carries lots of things and she's able to juggle a myriad of tasks and responsibilities. And just recognizing that coping is important in order to reduce stress and also to reduce the burden, the responsibility, the obligation that kind of weighs on the shoulders of Black women as they navigate the healthiness of their families. Next slide, please. So frequently cited coping methods that came across in the qualitative data in the interviews and the semi-structured interviews was planful problem solving. So we saw participants making active efforts to solve problems as a useful coping method. Can I think through this situation that I'm encountering and come up with some kind of feasible solution that's going to bring clarity and bring peace to the situation. Seeking out social supports, the use of both informal and formal social supports as a means to cope with challenges, whether that was going out with girlfriends or taking naps or working out, trying to think about how we use social supports in our communities as we share that kind of collective value, the cultural value of collective thinking. Positive reappraisal, so positive self-talk or reframing situations from a challenge to a strength-focused solution. Looking at, and specifically, we saw this repeatedly with a number of participants, that they viewed the challenge through the lens of spirituality and seeing this as something that could be overcome with God's help, or something that God had ordained for them to walk through. It was really about there being purpose and meaning in their experiences of pain and suffering. And then self-care, intentionally creating time to regenerate and relax, even if that's sitting by yourself on a lunch break for 30 minutes. But what does self-care actually look like, and how is that being implemented in the lives and contexts of these participants? Self-control utilized frequently as a complementary strategy for problem-focused coping methods in the interviews. So yeah, just utilizing self-control in order to troubleshoot situations and problems. Next slide, please. So we saw in our participants that they would oftentimes err on the side of being persistent professionally in order to counter perceptions of what a Black mother even looked like, and how those tropes were being associated to the Black women involved in the study. So engaging in, appropriate recourses of systems of support, trying to get their needs met by playing ball within the system, rather than coming off as, the angry Black mom, the hysterical mom, the mama bear type, or the mammy caretaking type. So trying to get their needs met within the system was really important. Utilizing linguistic and other types of cultural capital to push back against oppressive systems and advocate for their autistic children. And that it included instances of code switching in order to try to get solutions to different problems and to get their needs met. And then vigilant coping styles used by Black adults to anticipate discrimination and other factors associated with systemic racism was utilized more than white adults. So seeing vigilance as a protective mechanism in anticipating experiences of discrimination and racism. Intersectionalism from Kimberly Crenshaw, whoop, whoop. Female caregivers of Black autistic children must first counter sexism, racism, and ableism, right? So all of those things coming into play as we look at the context that these families are moving in. Next slide, please. Participants expressed a desire for inclusive spaces, and I think that's a repeated theme that we're hearing from the other presenters today, where they can authentically engage with other parents whom they felt could better relate to the stressors that they and their children encountered. Participants reframing challenges with creativity, using spirituality and positive self-talk. So that was really important to good mental health, and that was really important in achieving good outcomes for the children. Religious coping and optimism as protective factors leading to higher quality care and improved outcomes, right? So not negating the role of spirituality and religion and church connections in the lives of these participants. And then participant participation in self-care, which is a hopeful sign, right? We were so encouraged as we did this research to think that we were pushing up against the strong Black woman trope, that really it seems like there's a shift that's happening, and Black women are really beginning to take self-care seriously, taking resting seriously, seeing that as both a necessity and as an act of resistance to these systemic forces that are at play that we come up against. Next slide, please. So takeaways from the study. Parents use a diverse array of coping strategies and even combine different methods to address complex stressors. And as it's already been said, autism is definitely a marathon and not a sprint. So when you think about complexity, I don't know that life gets any more complicated than life with autism. Professionals should have deep and ongoing conversations about the way in which parents deal with stressors to ensure that they're coping and that the way in which they're coping is healthy. Leveraging the strengths of Black families and promoting strategies that are culturally informed and engaged. We need more of that, more of that, more of that. We need more recognition and more research to be done on the context and the lived experiences of Black families as it relates to autism. And then working to reduce the persistent and troubling racial disparities within the autism service system. So the delayed diagnosis, the misdiagnosis, the fact that Black families are often told their experiences and concerns are often minimized, or they're told to wait longer periods of time before anybody actually even assesses the situation to see what's going on. So working really hard to reduce those disparities is key. Next slide, please. I think that's it for me. So if you have any questions, please pop them in the Q&A, and I will come back to Dr. Rollins. Thank you so much for that, Dr. Rollins.
No, thank you so much, Kelley, and everyone. Thank you all for being here and for sharing your perspectives and your experiences and knowledge. Thank you for sharing the research and statistics and stories with us so that we can be more aware of the needs as well as the strengths of parents and children that are dealing with autism and other intellectual or developmental disabilities or mental health diagnoses. So thank you all so much for sharing with us. Again, if you all have questions for the presenters, please feel free to type them in the Q&A. The first question that we all have, and all the presenters, you can be back on camera if you're able to. But the first question we have is, what do you do to address parental burnout? And I think I know Ms. Sturdivant and I know Kelley also touched on this, but you all may want to elaborate a bit more. What do you do to address parental burnout?
I'll start. First, I didn't even know there was a such thing as parental burnout for Black women because I didn't even know we got burnt out. I thought, as Kelley talked about, we were just supposed to, keep kicking the ball down the road. But now I make a conscious effort to try to get some time by myself. And I want people to understand that when you do have a child with autism, you don't necessarily have that alone time. You can't just go into the bathroom and just get in the tub and leave your kid unattended. Do you know what I mean? So there are creative ways that we have to figure out how we get that time. And for me, it's a schedule. So my son is on a schedule, and I don't know what time it is now, but he probably should be going to bed soon. And so he goes to bed early so that I can have that time to rejuvenate and just kind of take care of myself, because a lot of times during the day, it's filled with activities and he's in school and I'm working full time. So if you could get a schedule for yourself and hopefully your child will be on that schedule, that'll give you some time to kind of rejuvenate so that you can get up the next day and do it all over again.
Thank you.
I can go next. I think so something about myself that I don't mind disclosing to people is that I actually have bipolar disorder too. And so for me, I have to be very, very intentional and rigid about making sure that I get enough sleep. That is probably, there are very few hills that me and my husband will die on when it comes to parenting our kids, but making sure that everybody goes down and that I get at least 8 hours of sleep, because if I don't, it has a knock-on effect on how I'm able to move through the world and parent the next day. So that is definitely something. And I talk a lot to my clients that I see in private practice about this, and I tell them, I have just learned over time. And so one, I think parenting an autistic child, you develop muscles, right? And you develop the muscles over time by doing the same things over and over again in the same way that you would build muscles when you go to the gym. And so I have learned over time how to steward my emotional energy during the day with clients, with students, with obligations, with work, with grocery shopping, with housekeeping, in order to conserve some part of my emotional energy so that my husband doesn't get the fumes when he comes home from me, and so that my children do not get the fumes from me when I finally make it home in the evening, right? So what do I need to do during the day to conserve my emotional energy? Does that mean that I need to have lunch by myself? Does that mean I need to sit in the car and listen to classical music or jazz? Do I need to like call my best friend and just have, a chin wag for 10 minutes? But what do I need to do in order to conserve emotional energy so that the people that I most love and care about in the world are being given some fraction of my best rather than leftovers is something that I've worked really hard over the last 8 years of marriage to kind of cultivate in our family. So I would offer that up as advice.
Awesome. We have a few more questions. So please share a bit, and this is for any of you, please share a bit of your experiences or findings related to autism and kindergarten transition.
I think I can start. I think any transition can be very significant for the child and for the family. And I think that it's important when you're doing a transition such as that to kindergarten to schedule pre-meetings with the teacher, with the school, and to request access to the school and the classroom in advance of the beginning of the school year, so that your child has the opportunity to develop their routine, and that the teacher has an understanding of what are the different actions that could trigger or result in a behavioral response in your child that they are not anticipating or prepared for. And that could be something as simple as if they're choosing to change the layout of the classroom. And so I think that it's just very important to feel comfortable with having those open conversations, and having the conversation with the teacher about what is a behavior that requires a intervention versus what is my child just being a child, right? And really creating that open communication line so that those conversations can be had. Because I think one thing when we're looking at behaviors, especially in Black children and specifically in Black boys, teachers, depending on their experience, their background, they are not always well equipped to or culturally competent to recognize when boys are just being boys and children are just being children. And the negative impact that can have on a child, where your little boy that used to love going to school all of a sudden doesn't like going to school because they keep getting reprimanded for just being a kid. I think that that's really important to have those open lines of communication and say, if you are overwhelmed as the teacher and you want to get my input on what works for my kid at home, let's have those conversations. One thing that I will also tell families is your child's behavioral therapist, if they are not connected to the school, you can give them the permission to have conversations with the teacher and with the behavioral health staff at the school, so that they can say, these are the things that we are working on with this child outside of the school setting. These are the modalities that we're using, and we can train you to do that too in the school setting as well. And so that way you're going above and beyond, which we have to do for our children. You're going above and beyond to set your child up for success and to let the teacher know that you're all on the same side and you're on the same team.
I can add just 2 seconds in with that too, because my reality in my personal life is my son is 5 and he's about to start kindergarten in the fall. And so this is right up our alley. I have invested in getting him he has a tutor that comes to the house because he's not in school right now. So we have a tutor that comes to the house that's getting him ready for kindergarten and for that more structured environment using play therapy. So we're doing that at just it's like 30 minutes twice a week. She comes just to help him try to channel some of his energy and start to develop some skill with impulse control and emotional regulation. We utilize Circle Time with Miss Monica on YouTube because she's amazing. She's a Black woman who does Circle Time for preschoolers. And so she does an entire 20-minute Circle Time experience. So he's practicing having to sit on the carpet and sing songs and engage with Miss Monica on YouTube. And then we just had his meeting at school where we had all of his evaluations lined up. And then we also had, so we've had conversations around what are his sensory needs? what are his communication needs? He's nonverbal and he uses a device to communicate. So what does that look like? And does the school have training on the device that he is utilizing, right? You know, what are his triggers? What is helpful in helping him to self-regulate and manage his impulses? And so we're having those kind of conversations, but just that kind of practical on the day-to-day. We're doing a lot of play. We're doing a lot of big gross motor movements because it helps him to get his energy out and it's helpful for brain development. So that's a little snapshot into our little family.
And I'd like to just chime in here. One of the things that was important for me when my son started kindergarten was to go and see the structure of the classroom and to see how it was set up, because my son also has sensory issues. And so when I walked into the classroom, there was papers like everywhere, and there was just a lot of stuff. It was cluttered and there was a lot of stuff. And I knew that my son was going to have difficulty because he tried to attune to everything. And I remember saying to the teacher, wow, this is a lot, you know. I don't know that my son's going to be able to do his best work in your classroom. And she, oh, Miss Sturdivant, no, don't worry about it. And within 1 week, I was called to the school, and I get to the office and my son's in the office flopping around on the floor like a fish because he was so dysregulated by all of the turmoil and everything that was going on in the classroom. And so if your son or your daughter or your child has sensory issues, you definitely want to make sure that the classroom's not too busy and that there's not a lot of interruptions during the day, because again, when they're trying to transition and they're trying to stay focused and you have people coming in and out of the classroom, that would really get my son off topic and he would become dysregulated by just all the other things that was going on in the classroom. So the way that the classroom is set up and the way that the classroom is designed is also equally important. What is he hearing? What is he seeing? What is he smelling? What is, you know, just all of those things.
So important. Thank you all so much for answering that question. We have one more or two. How can parents better educate themselves after a diagnosis has been received? And what national or local resources are available that can be given to parents?
I know there are a ton of resources out there. In particular, there's an organization called Autism in Black, and it's a Black mom who started a nonprofit that was looking at how does autism shape Black families and the Black experience. So I would say that would be a great place to start if you're newly diagnosed. You want to Google in your local community to find out what services are available, and don't forget about things that are offered through the city, whether or not there's like adaptive recreation services that are offered. Who are the good speech therapists in town? Who are the good occupational therapists in town? Are there any play sensory gyms for toddlers and kindergartners and first graders, right? Like, where do we go to get our energy out? What are the play therapy opportunities in your local community? What's going on at the library, right? So that would be like my initial. I tend to stay away from, and I'm blanking on the name, y'all help me out, the well-known autism organization that's like super
Autism Speaks.
Thank you. Autism. So I stay away from Autism Speaks. There's just something about it that's not, it doesn't compute for me. It's not a good fit for me. But I've been very methodical in trying to identify supports for autism, but then I take it one step further, and I'm looking for autism for Black families. I'm looking to connect with other Black families. I'm looking for people that look like me. I'm looking for resources that look like me. I make sure that, like, my son uses PECs, so the pictures to communicate with, and anything that has a picture of a human being is Black, because that's his reality. When he looks in the mirror, he sees himself. And so books and PECs and anything that's in the house looks like him. And that's just the rule in our house. And so sometimes my mother thinks that that's very like limiting, but I'm like, no, it's good. There's a purpose behind it. So that's what I would say initially.
And NC State also has an organization called FACES. It's led by Dr. Jamie Pearson, who is a mentor of mine, and she does specific work with Black parents around autism. She does a lot of research, and there are workshops and other activities where parents can go and talk with other parents, but also learn about autism and what it looks like for us. And I can actually pop that information in the chat.
And I would also say, speaking to your child's pediatrician, to identify any early intervention providers. Each state has a select number of approved early intervention providers, and really starting there, because that will be able to help you connect to speech therapy, occupational therapy, ABA therapy. But I definitely echo the sentiments of my co-presenters with regards to making sure that you're identifying service providers who, if they don't look like you, are culturally competent and are able to really guide you and your family throughout this diagnostic journey.
Awesome. Okay, you all, I think, have answered all of the questions. So I want to give you all an opportunity to just give closing remarks, any things that you all want to conclude with or leave the audience with. And so we'll start with Dr. Adeola.
I would just, first of all, take the moment to applaud all of you that are here this evening, whether you are a professional that is seeking to learn more so that you can do better as a provider, or that if you're a parent who is navigating this space, you're all warriors, you're doing amazing. And just being the advocate for whether it's your child or somebody else's child, treating them like they're your own, and really doing your best to find the best for them and building something that is person-centered and about them and for them. And that is the best that we can all do right now.
Thank you. Ms. Sturdivant.
Yes, I'd just like to say, as a parent of a soon-to-be 14-year-old and a professional, I just want to thank you all for wanting to learn more about parents, and just understand that when you are working with parents, we are human and we're tired, we're tired. So you may not always see our best selves, but please always understand that there's so much love for our children and so much love for the work that we do, that you may not always get our best selves, but our hearts are usually always in the right place.
Thank you. And Ms. Hollie.
I just want to say thank you for the opportunity. I love to talk about autism because it's such an integrated part of my life, my world, my day-to-day. So I'm just excited for the opportunity, and I'm available through email if anybody has additional questions that you don't feel comfortable asking in this setting. But this has been wonderful, so thank you.
Thank you all. So finally, of course, I put in the chat an opportunity for you all to complete an evaluation and let us know, your thoughts about the webinar or additional needs, questions that you all may have. You can either go to the link in the chat, or you can use your phone and scan the QR code there. I want to give you some time to do that, to give us feedback as we continue to build our webinar series and various topics that we want to make sure are resources to you all. So please complete that, and I'll be sure to also send the slides from these presentations to you, as well as the recording will be posted on our website. So please visit our website, check out the work that we are doing at the National African American Child and Family Research Center, as we're just starting, but still there's a lot of great information there and ways for you to connect with us. So thank you all for taking your time this evening to be with us and to hear these wonderful experiences, wonderful research that's being done on autism in Black families, and much more that needs to be done. So thank you again for your time, and we hope to see you all again soon.